Is that, can everyone see presentation? Looks good. Okay. And I'll try to keep an eye on the chat, but I can't promise I won't get kind of tunnel vision once this starts. So also feel free to unmute and just jump in with anything. All right. So just like a brief introduction, I guess, to the topic. Since I started graduate school and training, August has been termination month. When I would end treatment with my full caseload and transition to a new training site. I think that's probably a significant reason for why I chose this topic for my August Lunch and Learn. It's a topic I've thought a great deal about, in part, I think, due to my own attachment style and discomfort with endings. Every year, I would imagine possible ways that my mostly kind of unfinished work with my various clients could continue beyond the clinical placement. Maybe that client would find me once I was licensed. Maybe I would return to the Atlanta VA later in my career. But as I was always faced with ultimately having to say goodbye to clients I had grown to care for deeply, I found comfort in the idea that termination could be more than just a synopsis of what had occurred in the treatment and in the relationship between us, but it could in some ways be, you know, an essential or at least an important part of the treatment itself. So a way of meaningfully honoring the work that had occurred and the relationship that had been built, as well as continuing the work that brought the client to the therapy in the first place. So while I think there are infinite ways to think about endings, whether that's termination or any other kind of ending, attachment theory has offered me one possible guide to both approaching the end of treatment and to begin to think about what a meaningful and corrective end would look like for each unique client. Okay, so with just an hour, I've kept the objectives pretty focused. We'll discuss termination as a distinct phase of treatment rather than post-treatment, and consider a few ways that endings may offer opportunities to consider the therapy and continue the therapy and reinforce what has already been accomplished. We'll briefly review attachment theory as a means of thinking about both the therapist, the client, and also their co-created ending. We'll then consider ways of applying attachment theory to each unique therapy dyad as a means of avoiding potentially predictable defenses that would foreclose a more meaningful and corrective ending. And this will begin with considerations related to the client's attachment style and then move into an exploration of how the therapist's attachment style might inform the termination process as well. We'll review a few video clips, which will illustrate what a more engaged therapy ending does or doesn't look like, or could or couldn't look like, I don't know. And then begin to imagine new ways of ending that, that allow the end of therapy to be both reparative and reinforcing of therapy gains. So nearly all treatment modalities and protocols acknowledge termination as an opportunity for reflection, consolidation, celebration of what has been accomplished, and preparation for the future. It's easy to see why this phase exists and why it has the potential to solidify gains made in treatment and set the client up for success going forward. What is less frequently acknowledged, however, is the sense of loss that is also likely. Whether the treatment was just a handful of sessions or spanned several years, the therapist was likely a reliable source of care and support during a difficult time in the client's life. This may have been the first experience that the clients had with sharing their internal world with anyone. It may have been one of the first truly safe relational experiences they've ever encountered. All of this is to say, this is a significant moment of loss. This loss is made all the more impactful or salient in light of significant prior attachment injuries or other significant losses or abandonments experienced by many of our clients, particularly if the therapy is ending at a not mutually agreed upon date or not by the choice of the client. McNeil, Hasty, and Burke in 2010, their 2010 article suggests that for these types of cases, termination can represent the most important part of treatment, in fact. And if approached thoughtfully, can begin to revise a client's template for loss as, inherently rejecting and traumatic to an experience that can be collaborative, meaningful, and reflective of the care that was present in the relationship throughout the therapy. In any case, the loss of termination offers an opportunity to practice newly learned cognitive and behavioral approaches to managing loss and negative affect, and the possibility of engaging healthy grieving that solidifies treatment gains and offers corrective relational experience. So while every client is, of course, going to require a tailored approach that will be informed by treatment modality, the therapist's theoretical model, and any structural parameters of the treatment setting, attachment theory offers a way of thinking about endings that can be useful across different treatments and modalities. So before we talk about attachment theory as a lens through which to view or think about termination, it felt important to provide a brief refresher on attachment theory. Hopefully this is helpful. So it was John Bowlby in 1973 who first theorized that the way a child learns to relate to their primary caregivers during infancy, particularly during times of stress or uncertainty, greatly influences the ways in which they relate to both themselves and others for the rest of their lives. So in these moments, an infant begins to think of themselves as deserving or undeserving of care, safety, and comfort. Similarly, the infant learns to see others as either a haven of safety and comfort or as unreliable in this way. Ainsworth and others in 1978 built on this theory, finding that when separated and then reunited with their mothers, which is termed the strange situation paradigm, infants responded in one of three distinct ways, each corresponding to a different working model or attachment style. That was secure, preoccupied, or dismissive or avoidant. An additional attachment style, fearful, which is also known as disorganized, was later added, which captures the infants who didn't respond to their caregivers in a consistent or predictable way. These styles are generally thought to remain relatively stable and continue into adulthood, as the infant's earliest experiences shape their interactions with others. And throughout childhood and adolescence, working models of self and other gradually kind of solidify and generalize from primary caregivers to significant others. Though attachment style looks similar to infant attachment style, adult attachment style looks similar to infant attachment style, Bartholomew and Horowitz in 1991 extended Bowlby's work in an effort to identify the crystallized differences in working models among adult attachment styles. Securely attached adults tended to view themselves as lovable and others as responsive. They are comfortable with intimacy and vulnerability and report a readiness to rely on others for care and support. You can see all of this kind of outlined in this graphic here. Anxious, formerly termed preoccupied adults, greatly desire closeness and view others, at least intermittently, as responsive to their needs, but continuously doubt their deservingness of love and care. These adults tend to be low in behavioral avoidance, but greatly fear rejection due to their poor self-image. And then avoidant, formerly termed dismissive adults, are contrarily thought to possess a more positive view of self, but hold less of an expectation or desire for closeness and support of others. They tend to avoid intimacy, at least in some ways, and prefer to operate more independently, particularly during times of stress. These adults learned at an early age that they were on their own to cope with life's overwhelming moments and found ways to kind of distance themselves from situations and feelings that were too much for them as kids. And then finally, just to mention the fearful avoidant adults, they view themselves and others negatively. They see themselves as undeserving of love and support, and while they desire support and long for that connection, they expect others to disappoint, reject, and possibly harm them. So for this reason, like those with a dismissive avoidant attachment style, the fearful avoidant adults tend to shy away from intimacy and vulnerability, though their desire to connect can manifest kind of a confusing pattern of approach and withdrawal. So for the remainder of today, I'm going to be leaning really heavily on the work of Sherry Marmarash. She's an attachment researcher at George Washington University. In her 2017 paper, Fostering Engagement During Termination, she argues that attachment theories focused on how prior losses inform a person's sense of self and their expectations of others, their capacity for relationships, and their coping strategies is uniquely helpful in understanding the varied reactions people have to the goodbye of termination. Further, as endings activate both client and therapist attachment systems, she argues that emotion regulation strategies used by both members of the dyad can either facilitate deeper engagement or result in more defensive avoidance. So importantly, not only can a client's response to termination limit opportunities for growth and healing, but so too can the therapist. Without awareness and attention to their own contributions, therapists can find themselves caught in an enactment where, to quote Marmarash, the therapist, like the client's earliest attachment figures, can be experienced as unable to tolerate the client's needs and feelings. Instead of offering a new experience of safety, intimacy, and gratitude, therapists may unknowingly and unintentionally replay a more familiar feeling of shame and disappointment. So before moving into the meat of this presentation, I do need to give the important heads up that Marmarash only addresses attachment styles secure, anxious, and avoidant. She unfortunately leaves out fearful, disorganized as a therapist or client attachment style. I included fearful, disorganized in the prior slide just to help us kind of start to imagine how this emotional and relational approach might map onto therapy and a therapy ending, but that won't be the focus of this presentation, or a focus, unfortunately. Okay, client attachment style. So first, beginning with the ways a client's attachment style may inform their desire and ability to engage in the emotional experience of termination, starting with secure. Secure clients are likely to possess an overall greater capacity for the emotional complexities of intimacy. As such, they'll generally weather loss with less distress. Secure clients may have come in with or have developed various coping resources and a more dependent support system that they can lean on when they're experiencing loss. These supports allow secure clients to access and more easily acknowledge both the gains and losses of treatment. You'll likely notice more primary affect during termination, both positive and negative, and less anxiety and depressive affect overall. Importantly, Bowlby hypothesized that when faced with loss, secure individuals have developed the ability to draw from internal memories of their attachment figures, which sustain connection across physical distance. So therapy is ending. Even so, the mentalized relationship that was built internally does not end. Okay. So I'm just going to read this quote out loud. I really am grateful to you for being there for me all these years. You've given me something that I will always have, and that is the feeling that I am capable of overcoming even life's most challenging moments. Now, when I have this really negative fear about the future, I hear your voice telling me to stop. Stop listening to that because it may not be true. I hear you, and I know I can get through this. I can do this. So this was an abridged snippet from one of Marmarash's sessions, providing an example of what a secure client may more naturally sound like during termination. So you'll notice the client's emotionally connected expression of gratitude, as well as simultaneous sadness present in the client's tears. And maybe most important, about this particular example is the way the client speaks to the ways they've internalized their relationship with the therapist and the therapist's voice in moments of stress. Okay. Anxiously attached clients, on the other hand, tend to have a more difficult time activating their parasympathetic nervous system to emotionally regulate and are more likely to experience a fight or flight response to termination. They may lean on various forms of what researchers have termed protest behaviors, which, while counterproductive in therapy, as well as in their other adult relationships, most likely, are meant to elicit care and attention while minimizing vulnerability and rejection. So in the context of therapy, this could look like arriving late to session, no-shows and cancellations, payment disputes, the reemergence of symptoms, and increased secondary emotion like anger and anxiety. You may find that anxiously attached clients become more sensitive to signs of disapproval, disinterest, or abandonment by you, the therapist. This might also generalize or translate during this time to the client's relationships outside of the room. Research has shown that these clients are able to more readily access painful memories and exhibit almost an automatic spread of negative emotion from one remembered incident to the next. So a perceived abandonment by the therapist may increase the client's vigilance for potential abandonment elsewhere, and that might be how you pick up on this. During and following termination, these clients might also struggle to tolerate the separation and may continue to seek out the therapist for years after therapy has ended. If you are going to keep asking me, I guess I'll tell you. The truth is, I feel like you don't really care about me. I know you gave me these referrals and said I had done good work, but deep down inside, I wonder if you just want to get rid of me, and the 12-session limit is just an excuse. Like with my past therapists, I guess I'm disappointed all over again, but why should I expect anything different here? Then another snippet. This client's abandonment fears and rejection sensitivities are very much alive in this example. You get the sense that the client has been reluctant to share more vulnerable feelings and fears so far in termination. Their anger, anxiety, and dysphoria are notable, and you can see them kind of fitting this particular ending snugly into their larger historical narrative of endings, which have been experienced as disappointing, rejecting, and reinforcing of their own unlovability. Unlike anxiously attached clients who tend to hyperactivate in the face of loss or perceived abandonment, avoidant clients tend to utilize deactivating strategies, which split off and kind of compartmentalize feelings of longing or despair. So for this reason, these clients are less likely to express primary or secondary emotion during termination. They're expert at redirecting attention away from thoughts, feelings, and experiences that might threaten their sense of self-sufficiency with feelings of dependence or vulnerability. These clients may have allowed themselves to attach and depend on the therapist in moments and may only be deactivating and distancing from painful affect during termination. Or these clients may have, they might be individuals who've been difficult to kind of engage in the relationship from the start or throughout. Through emotional distance, they might have protected or deprived themselves in some ways of a closer and more intimate relationship with their therapist and may genuinely experience less grief. In any case, they will likely present as less affected by the end and more likely to minimize the importance of treatment, and then might also end therapy early. It's another example. There we go. We had a good relationship, but you all are professionals. No offense. You can rely on therapists when you need them, say goodbye, and then work with another one. When it's time to end, it's time to move on. So this client presents somewhat matter-of-factly and focuses on the professional, if not transactional, nature of the therapeutic relationship. The client positions the relationship as an impersonal kind of exchange of services, appears to experience therapists as somewhat interchangeable, and focuses on the future when it's time for ending to happen. From this statement, it's kind of unclear, I think, to what extent the protective framework has guided the client's approach to treatment and the therapy relationship overall, or if the use of this deactivating strategy has been mostly confined to termination. The language utilized, acknowledging both reliance and need, somewhat indicate to me that the client may be leaning on this strategy more so now than they did throughout treatment. But in any case, this approach to managing affect through interpersonal distance offers ample opportunity, I think, to explore and come to some kind of greater understanding about their interpersonal style. Okay, therapist attachment style. So to shift the focus from client to each of us, the therapist, Marmarash argues that as the secure base, the therapist's contributions to termination these are more important actually than the client's. Research has shown that therapist insecure attachment is correlated with greater incident of negative countertransference, as well as perceptions of the ruptures and the alliance that don't exactly match the clients, all of which are relevant during termination and throughout treatment. So focusing now on ways an anxiously attached therapist may approach and shape therapy endings. Endings may be particularly activating for the anxiously attached therapists. They're more inclined to perceive the termination as an abandonment, whether by them of the client or of them by the client. In response, they might find themselves emphasizing positive aspects of the treatment in an effort to kind of avoid the conflict and reduce guilt. Conversely, they may be more in touch with the pain and sadness of termination personally, which could cause them to neglect the hope, gratitude, and progress that's present. When possible, anxiously attached therapists are more likely to look for ways of avoiding the goodbye entirely, even when maybe not clinically indicated. So this could look like an extension of treatment beyond what's helpful or necessary, or by positioning an open door policy as reducing the need for a goodbye kind of entirely. Okay, so I'm still questioning my sanity for opting for this over simply including the vignette scripts in the body of the slides, but a friend of mine from graduate school graciously agreed to role play the vignettes that were kind of outlined in Marmarash's work, illustrating differences in the ways that therapist attachment styles could interfere with engagement during termination. So in this short snippet, you'll see how anxious avoidance of termination by the therapist might manifest.
So yeah, I thought about the fact that we're ending and that we have to say goodbye. And I realized you really helped me get through an awful time in my life. I was definitely really lost, and you always supported me, and I could really feel that.
I've also really enjoyed working with you. I was thinking about it, and while we have to end today, I do intend to return to my practice in a few years, and we can always resume at that time.
Oh, so we could work together again. That would be great. I would love that.
Yeah, I'm glad to hear that you feel that way. Would you like for me to reach out when I'm back? Okay, great. I'll make sure to save your phone and your email, and then if that works, I'll reach out maybe a few months before I start practicing again.
Perfect. I'll just wait to hear from you then.
In the meantime, since we are still ending, we should return to processing and discussing referrals.
Well, I mean, now I feel a lot better. We're not actually saying goodbye, and I can just work with one of the referrals until you're back.
Okay. So the video starts with the client expressing vulnerability. while the therapist self-discloses her positive feelings towards the client, she moves away from the client's expressed gratitude and underlying sadness as she kind of attempts to bypass the reality of their ending with this potential possibility of future work together. Further, she also offers relief from sadness with a potential false promise that could also interfere with the client's ability to attach to a new therapist. The client willingly follows, relieved to avoid, confronting the pain inherent in this loss. And with reduced anxiety, the therapist then attempts to return to processing and preparing, but finds the client is now kind of no longer in need of that and only has need for logistical clarity, maybe around next steps, not really feeling that grieving is necessary.
So yeah, I thought about,
Sorry, 1 second. Okay. All right. So like avoidantly attached clients, avoidant therapists may minimize their importance to clients and their importance to their clients' importance to them. They might feel uncomfortable with the idea of client dependency or feel unable to relate to the loss the client could be experiencing. Having split off maybe some of these feelings in themselves, they could miss signs their clients are experiencing intense loss as they approach the end of treatment. They might end treatment prematurely, maybe reserving less time and space for the relationship to be processed and grieved. They might also resist exploring new areas of growth or development for fear of kind of increasing more of that closeness and dependency. Sharing some similarities with anxious therapists, they're likely to focus on the wins of treatment, the positive aspects of the ending, and the logistics of terminating, leaning very heavily on intellectual summaries of the work. Another video, but with more of an avoidant approach.
I thought about it, the fact that we're ending and I'm saying goodbye to you. And I really realized how much you've helped me get through this awful time in my life. You always supported me, and I really could feel that.
You've made so many positive changes and now you can trust more.
I can trust more, actually, and it's because of you. And now I think I really can take more risks, and I think you really helped me so much on that front.
Right. Yeah, that's right. You can take more risks. It's so wonderful. I wonder how you see yourself down the road as you continue to take more risks.
Yeah, well, I really do think, I hope that things continue to go well down the road.
Okay. So just as in the first video, the client kind of begins with vulnerability, maybe looking away as she speaks, indicating that there's some potential shame or hesitancy as she puts words to her gratitude. But the therapist focuses on the client's growth, offering praise for her work and the change experienced in treatment, but kind of moves away from the gratitude and the more interpersonal engagement. The client tries again to get close, attributing her growth to the therapist. And while the therapist acknowledges and affirms the client's progress once again, she redirects the clients away from both the relationship and the client's emotional experience by focusing on a more intellectual exercise of imagining the client's future. Client follows, but what is happening relationally and emotionally between the client and therapist is importantly missed.
I thought about it, the
Did it
fact
again.
that
Sorry. Okay. So what could be a corrective goodbye. Therapists who are more securely attached experience significantly less anxiety, depression, and dysphoria at termination, and are more easily able to focus on the here and now experience of the session. It feels important to acknowledge that the therapist doesn't need to be securely attached necessarily to facilitate more of this kind of ending. It just might take more effort to focus kind of more naturally on the here and now process of these sessions. While it's essential that the therapist also accomplish the other tasks of ending, like logistics, referrals, imagining and planning for future obstacles, highlighting treatment gains, all of those things. these therapists are more easily able, these being secure therapists, are more easily able to sustain emotional connection through till the very end, which accomplishes what an early supervisor of mine used to call really staying until you go. Marmarash emphasizes that it is precisely because endings tend to activate attachment systems and related emotion regulation strategies, such as fight or flight or shutting down, that these moments really can be critical opportunities to put the work of therapy into practice. But for this to happen, therapists must be able to recognize when these strategies are at play and then help the clients make meaning of these experiences, assisting them as they, kind of try to remain engaged while experiencing distress and establishing or reinforcing more adaptive ways of coping, both internally and through their support systems. Okay, and then this one's a little bit longer and is supposed to demonstrate a more kind of engaged, emotionally present ending.
So the movers came, unpacked, sort of. I mean, I leave on Tuesday, so I still have so much to do, like a million different things. I'm not sure which room to start with first, and I should really try to make labels and like lists and everything for what's in what box, but yeah, I don't know. It feels like a lot. Probably we'll start with the kitchen because that has the most crap.
Can I stop you for a second? I noticed we're not talking about this being our last session together.
Well, I have a lot on my mind. I'm sorry. The move is just a lot and I just have so many things to do. And like I said, I just have this long list of things that I feel like I've maybe made like a quarter of the way down. And yeah, I'm doing it by myself. So I'm just worried that I'm not being organized enough about it. But yeah, I've actually found this app that's really helpful for packing stuff. And so can tell me like what's in each container. So that's been somewhat helpful.
Right, you do have a lot to do. And I noticed as you were sharing everything that you have to do, I kept thinking about how this is our last session together. And I had this feeling of sadness, that this will be the last time I see you, that next week you will, not be here and I'm gonna miss you. You're tearing up.
Yeah, I'm just surprised you said that.
What part?
I don't know. I think when you said you'll miss me.
Hearing I will miss you.
Yeah, I've never had anyone say that to me before. And I know I'll miss you too.
You're looking away.
Yeah, I've never had anyone say that to me.
Stirs up a lot of strong feelings in you when I say that.
Yeah, I mean, I've been saying a lot of goodbyes lately. And I have a lot of friends, but deep down inside, I mean, I never think they actually care as much. Like with college ending and moving, everyone says they're going to stay in touch, but like, you kind of know you won't.
There has been a lot of goodbye lately, and you wonder if anyone really cares. Do you wonder if I care right now?
I think that's why the tears came. I know you care. I do. And I think hearing you say that, it just surprised me. Like, I know you care, but I also know that this is your job and you get paid to do this. So I don't know. I didn't expect it hit something.
There's this feeling that it surprised you, that I said, I will miss you. And you started crying.
Yeah. Something about hearing you missing me next week. I think that made it more real for me. Like you're actually in this with me too. And it's not just me ending and moving on to the next thing. I don't know, I guess I feel like I do matter to you, and I don't know, I don't get to hear that a lot.
Not as much as you need to hear it. And so when you heard it, it triggered all these feelings inside.
Yeah. I still feel it now. It's weird. It's a good thing and a sad thing too. I guess sad because I didn't have a lot of that growing up. Or even with like my closest friends. But also good because it's different from them and it is what I want. And, you know, like you and I have talked about this so much, how, you know, I don't trust that I'm worth it. And I think I was feeling that a lot more this past week. Yeah, so when you said, I'll miss you, I felt it. Like how we talk about letting the good in. And yeah, I guess it did go in this time.
Okay. So this sketch illustrates how a therapist can engage a client, even when the client is maybe more inclined to withdraw. So the therapist remains attuned to the present process. She's open to her own personal experiences and, you know, feelings of loss, and stays present with the feelings that emerge in the client. Often in this example, you probably noticed that staying present just meant reflecting what the client was sharing, or what the therapist was seeing in the body language of the client, which seemed to help the client remain open and curious about her own internal experience of their goodbye. Without any additional prompting, really, the client felt safe enough to reflect on her disappointment in other goodbyes, as well as reflect on ways in which this one felt so different. Marmaraj argues that purely by staying present, the therapist is giving the client one more experience with her secure base, which she can then take with her. Importantly, an emotionally engaged therapy ending can take place even when treatment was complicated or less successful. It can be in some ways even more impactful for a client to experience a goodbye that fully and openly acknowledges the losses, the disappointment, and the frustration of therapy. Niemeyer, Baldwin, and Gillies found in their 2006 study that the ability to make sense of loss moderated the relationship between attachment to the deceased in this case, and complicated grief and mourning. So specifically, the more attached the person was to the deceased person, and to be clear, this wasn't necessarily a therapist, this was just looking at death and mourning. But specifically, the more attached the person was to the deceased, the greater post-loss trauma, but only if the individual was not able to make sense of and integrate the loss for themselves. So this suggests that regardless of whether the ending is unexpected, determined due to lack of progress, or mutually agreed upon after years of successful work, making space to reflect on and make sense of the time spent together can have these lasting positive effects.
So,
Okay. So before wrapping up, there are a few important topics, more than the ones I've listed here, but a few important topics that I want to highlight as not having been addressed by this presentation. The first is multicultural considerations and the impact of other identity variables on attachment. Variations in attachment have been observed across cultures, though the differences appear to present primarily in at least from the studies, in the distribution of attachment styles within cultures, so prevalence numbers primarily, rather than in the attachment bonds themselves and how those look. This may be in part because the research shows that it is caregiver responsiveness and attunement to the baby's needs, so comfort, feeding, changing diapers, creating the conditions for sleep, that matter most, rather than precisely how many caregivers are a part of the child's life, who the caregiver is, and the nuances in their responding. When controlling for socioeconomic conditions and related stress levels, which have been shown to impact attachment, similar levels of responsiveness were observed across US, Japanese, Israeli families, and other non-Western cultures and families. That said, critics argue that attachment itself might not be an applicable or useful construct when applied to non-Western cultures. The strange situation, which was conceptualized by Ainsworth, a Canadian-American psychologist, may not feel so strange if a child is used to a more communal parenting situation rather than a more kind of individualistic situation. More characteristic of Westernized parenting. So in other words, attachment as a Westernized lens could distort our understanding of non-Western relational patterns. As is usually the case, more research is desperately needed to examine the applications of attachment cross-culturally, as well as in the context of other identity variables that may impact both the individual and relationships more broadly. The next two here have been mentioned but deserve additional underscoring. This presentation did not attend to how other treatment factors such as treatment length, modality, theoretical orientation, therapist style, therapeutic alliance, or specific reasons for terminating might impact how termination is experienced or approached within the dyad. This presentation also, unfortunately, as I mentioned before, did not address how disorganized attachment on either the part of the therapist or the client may play out in the context of therapy endings, though my hope is that the general understanding of disorganized attachment in adulthood might kind of help us imagine what this could look like. So roughly some combination of some anxious and avoidant, both of them, strategies are likely to kind of show up, but that's really just a very rough sketch. In any case, all of this is kind of to say that the entirety of today's presentation might not be helpful or applicable to every single client or every therapy relationship, but my intention is that, I've at least offered more or one more way of conceptualizing some of the therapy interfering behaviors that both we and our clients introduce at the end of treatment, and providing possible ways of enhancing engagement and even using these very behaviors and defenses to co-create endings that aren't just meaningful, but more connected and therapeutic and corrective. Okay, so that's all I have for today, but I did want to leave time for questions, comments, and also time to transition to whatever's next. My references are to follow here. Okay.
First, I just want to say that was so great. I don't think I have had a training or conversation about termination since graduate school, which was a long time ago, but it stuck with me. I mean, I'm psychodynamically trained, so all of this is very aligned for me. So I'm curious to hear from people who maybe aren't coming from that theoretical orientation. Your acting was good. I had a tear.
No way.
Anyone else?
I don't believe it, but thank you. I thought my friend was actually very good, but
I was just going to say, great job, Caroline. And I too, like, I haven't really received a lot of instruction in termination, and I've never thought about it in terms of like attachment, right? That might be going to the back of my mind, but I'm usually like, okay, we're terminating because we've reached the end. So I don't really think about it too much right? I'm like, okay, what do I need to do? How do I make sure that this goes well? But the attachment piece makes sense, right? And I was reflecting on terminations I've done like in the last year of like, was I avoided? Like, was there a better way to handle it? Did I miss something? You know, some of those things. And I also appreciate your attention to the fact that there is like a culturally bound component to this, right? And I was reflecting on that even before you brought up the research of like, yeah, like my little nieces and nephews that are used to having a ton of uncles and aunts around and just like trusting this like umbrella of adults around them in like a more clan system or something else. Attachment is going to look probably very different. So there is that skew, but definitely helpful to think about as I'm like thinking about even future clients that I'm going to be terminating with relatively soon. So thank you.
Yeah, absolutely. I'm so glad. That's definitely how I felt or was feeling when I started kind of frantically searching the internet for articles or just more guidance, approaching the endings that I was, or like my therapy endings at the Atlanta VA. I also hadn't really thought about endings from this attachment perspective in quite this way, and found it, I don't know, it felt very useful to me. So I'm glad you felt that way.
I found myself reflecting on one, obviously being new here. This is my third week, which means that I said goodbye to all of my clients when I left. And, you know, working in college student health and being limited to only work with actively enrolled students, I was used to students leaving me 3 times a year. So graduation times, you know, December, May and August. But it was really, it was very odd to be on the other side of it. And a lot of those terminations were logistically, you know, oriented because they were going to lose their student health insurance. They weren't students anymore. So we had to end. But it was, you know, after almost 17 years of being in the same spot, it was very odd to be on the other side of it as the one who was initiating all of the goodbyes. I was very used to people leaving my care. I was not the one who was used to being the one to leave. So I really appreciate this. It was very timely and offered me an opportunity to reflect on that, and also reflect on how I want to manage termination moving forward. So thank you very much.
Yeah, of course. Thank you.
I want to thank you too. This was very helpful to me too in helping me reflect on things in a way I hadn't really thought about it before, despite being heavily attachment focused myself. But I'm wondering, like, if you have thoughts about clients who do kind of respond by canceling sessions, right, or wanting to not make space for that, you know, how much do you feel like insistence or you know, pressure, I don't know if that's the right word, but to make more space or like to kind of show up for that goodbye?
Yeah. It's a great question. It's definitely one that I struggle with, in terms of, I mean, both like the ways in which the client is taking so much out of your control. You know, they just might leave, they might not show up again. You might only have one session to kind of make space for this. And that, as you're saying, does put a lot more pressure on that one session. And of course, there's only so much that can be done at that point. I think I don't know, what I feel like this particular article, or this way of thinking about it provides is not necessarily, I mean, my hope is that it's not necessarily experienced as pressure, but more as like, a way of reflecting at least on what we can control as therapists and the ways that we might be contributing. And, you know, if there is any avoidance that comes up in us in that last session, when you only have that one session because they've been canceling or whatever it is, if there's any avoidance that you are feeling to kind of just, well, they don't seem to want to talk about it, I'm not going to talk about it. to just, I think, take a moment to think a little bit more deeply about like what part is yours, what part's theirs, to consider that even if they're behaviorally kind of avoiding this kind of emotionally intense goodbye, that it might also be exactly what's needed. And that maybe this kind of framework gives each of us more courage to move towards that.
Thank you.
Mhm. Thanks for the question.
Thank you again, Caroline. And now
Thank
we'll
you.
say goodbye to each other. All right, everyone, have a wonderful week and see you soon. Take care.
Bye. Thanks again.